guys. Today, my name is Emily, and I think I've talked to some of you guys before. But I'm going to give you a little talk today about something that I think you'll probably encounter at some point in your life. And that pertains to my field, which is nursing. So humans, well, quite obviously, especially in America, spend a lot of time around other people, especially when you consider that a lot of us are going to go to work in huge buildings someday, huge corporations, and we're going to go to gyms every day that have tons of people at them and doctor's offices. And chances are, at some point in your life, you're going to be in one of those places when someone collapses and you know that they are having a heart attack or a stroke. And you're going to ask yourself, what am I supposed to do? We know that those are two things we hear about happening all the time. But when that happens, I want you to be ready. And so I'm going to give you some things to know about stroke and heart attack so that you know what to do when that happens. The first thing I'm going to talk about is the difference between a heart attack and a stroke. And this is according to the My Doctor website and the American Heart Association. So when a heart attack happens, essentially blood flow to the heart stops. So oxygen doesn't get to the heart, and a piece of the heart, like a chunk of the outside of it, will die. A stroke occurs when the arteries that they come off the heart, but the arteries probably around this area to the brain become clogged, blocked, or they break, and the brain doesn't get oxygen, and so cells die. These are both very serious, very common, and it's imperative with both of these, but even especially with stroke, that you get the person to a hospital immediately and you know what you're doing. So being educated can reduce complications that occur with this, both for the person who this happens to, and can also prevent their death. And these are super common, so it's so important to know them. So the first one I'm going to talk about is what to do if you encounter a stroke. Now, the way you're going to tell that someone is having a stroke is that on one side of their body, they're probably going to have numbness or weakness, and it might be all over their body, but it normally tends to be on one side. It might be, part of their arm and part of their leg. It doesn't need to be right next to each other. They're going to have slurred speech or trouble communicating. They'll have impaired vision and hearing, which can be part of the trouble communicating because they may be unable to form words with their mouth, or they may not really understand what's going on in their external environment because their hearing and vision are impaired, so they can't really communicate with you then. And then the last one is that they almost always will have a severe headache because essentially their brain isn't getting any oxygen, and they have this headache because the brain cells are screaming for air. That is from the National Institute for Neurological Disorders and Stroke. So when you identify some of those things that are happening in a person, the first thing you're going to do, and the first thing you're going to do in any emergency situation, is to specifically point at someone and say, go call an ambulance. Don't just yell for someone to do it, because a lot of times when that happens, no one will do it because they think someone else is. So say, call an ambulance. And then for a stroke victim, in this situation, you can't do anything, but you do need to sit with them and wait. You need to pay attention for if they were to go unconscious, stop breathing, or their heart stops. Now, if you are trained in how to do CPR, go ahead and perform it if they stop breathing. If you're not, don't do it because you can do more damage. But I would recommend having someone bring in a heart defibrillator, and you can use that on them if it is one of the ones that talks you through the steps. So that is what to do if someone has a stroke. Now the next one is about heart attack, and I'm going to tell you some stuff from the American Heart Association. You can tell someone's having this because they'll have pressure or pain in their chest, discomfort or pain elsewhere, they'll be short of breath, they might have a cold sweat, feel nauseous, or have a lightheaded headache, feeling dizzy. So, and a lot of times with this, they'll notice it days beforehand, So if that happens, they should go get it checked as soon as they start feeling weird. But when it happens, again, the first thing you need to do, and in every emergency situation, is tell a specific person, go call 911. You then need to immediately find aspirin, and help the person sit up and have them chew a couple aspirin and then swallow it with a full glass of water. It is really important that they chew the aspirin up really well, and yes, it's going to taste bad for them, but they need to chew it because when they swallow it, then it gets into their system a lot quicker. And the full glass of water is important because that also helps it get into their system quicker and swallow all of the medication. Again, sit with them. With a heart attack victim, you need to lay them back and have them remain very calm and still, because you don't want, think about it this way, you don't want their heart rate getting up. You want them to be as relaxed as possible. Watch for them to become unconscious, stop breathing, or for their heart to stop beating. If you know how to perform CPR, go ahead and perform that, and go ahead and follow the AED or the defibrillator instructions if their heart stops. And that's what you do for a heart attack. Now, these stroke and heart attack are both very common, and it's extremely important to recognize them when they're happening, because chances are at some point in your life, I can almost guarantee that you are going to be around when something like that happens. And I hope now that you feel confident in your ability to recognize these for what they are and to know what to do in these situations, because most of you will see it happen. So hopefully you are a little more confident today so that you can be that person that knows what to do in the situation. Thank you.